Men experience mental health struggle at just about the same rate as any other gender. But in 2017, over 3,000 men died by suicide in Canada. That's more than 3 times the number of women. Men with mental illness are also far less likely than women to have had treatment in the last year. People of all genders have difficulty reaching out for help, but it's men who are the least likely to seek support when they're struggling. That silence is harmful. It prevents help from getting to the person who needs it, they don't get to talk about it, and people around them might not realize they need extra support. With all we know about the importance of seeking help when we're going through a mental health struggle, what exactly is preventing men from reaching out when they need to? From the time boys are very little, they're conditioned to keep quiet about emotion, stay silent, or suffer through tough times alone.
There's mostly all these chiseled men that are tall, very muscular, predominantly white, who are referred to as like the top of the chain. And so then it's like, how do other men keep up with that?
So men are walking around with unnecessary and unhealthy narratives that's causing unnecessary suffering for them.
That comes into effect if a mental health struggle surfaces later on. Men tend to be conditioned to ignore health issues, and even if they notice they're struggling, they might not feel comfortable opening up about it.
So men may express it more with anger, rage, substance use, lots of irritability, more so than women.
Headaches, digestive problems, and chronic pain can be signs of mental health disorder. This means that we don't always recognize what's really going on, and it contributes to the fact that men themselves struggle to recognize symptoms of depression in themselves.
And so sometimes it's under-recognized not only by the men themselves, but the people who might pick it up. Family members around them, health professionals.
But the gender isn't the only factor here. Our society also treats men differently depending on who they happen to be. Men dealing with transphobia, homophobia, racism, ableism, and other forms of discrimination are more likely to face challenges to their mental health and have difficulty getting the help they deserve even when they are able to ask for it. In Canada, racism towards Indigenous peoples and the dominance of colonialist systems have created conditions where the average suicide rate for Indigenous men is double that of the national average, with the suicide rate for Inuit men 11 times the national average. Working to change all of that requires us to deal with our society's shortcomings. We need to address how harmful ideas about gender, exclusionary healthcare systems, and discrimination and judgment work together to create an environment where men aren't getting the support they need. And at every level, we need to work to undo the harm that has been done by creating spaces where men can open up, by encouraging people when they show their authentic self, by supporting policies that will create a more equitable healthcare system, a more equitable world. The time to get to work is now.